Purple Solutions to Fix Healthcare in America podcast. Each week, we explore bipartisan solutions to healthcare reform through discussions with leading experts from across the country. To learn more, go to purplesolutions.org and join us at our Healthcare Economics Summit on July 31st.
Hello again, I'm Dan Sem, Dean of the Batterman School of Business and Director of the RX Think Tank on our next edition of the Purple Solutions podcast. And I'm real excited because today I'm here with Cynthia Fisher. And Ms. Fisher is a life sciences entrepreneur, former CEO of ViaCord, and currently she's founder and chairperson of patientrightsadvocate.org, an organization that advocates on behalf of patients, families, and caregivers so that they can get real-time access to system-wide price transparency. And we're going to learn a little bit about what that means in a second here. So, Cynthia, thanks a lot for speaking with me today, and especially on July 31st at our Healthcare Economics Summit. So,
well, Dan, it's a real pleasure to be here today, and I'm looking forward to that summit next month.
Yeah, should be a lot of good discussion topics going on there. Maybe a little bit of fireworks too, because we've got people on both sides.
Yeah.
So yeah, thanks for agreeing to speak for that. That's going to be awesome. So why don't we start right away with your current venture, patientrightsadvocate.org. What's the story here? Can you tell us a little bit about how and why you formed this organization? What's it all about in your journey to get there?
Yes. As you mentioned earlier, I'm a life sciences entrepreneur. I've worked across the spectrum of healthcare from the very beginnings of my career with IBM with healthcare information technology. And I helped to automate hospitals and insurance companies. And then I went back to graduate school and got my MBA and went into medical device. And I ran a blood bank division for a medical device manufacturer that separated blood into its components. I left there to start my first company, which is called ViaCord, cord blood stem cell banking company that exists today. It was taken public in 2005, and in 2007, PerkinElmer bought it, and it still exists today, providing any family the ability to bank their newborn child's blood that's left in the umbilical cord to test, type, freeze, and store the cord blood. Now, I started that company back in 1992, and it was price transparent, where we stood behind the same price for all parents and patients, and we guaranteed the storage fee for in perpetuity for the storage of that cord blood, and it was conducted through telemedicine.
Okay. You're combining all the technologies that are hot now.
and so now these very technologies and price transparency in itself is hot right now. And in fact, so hot that I actually, you asked about patientrightsadvocate.org. 3 years ago, I went to Washington because I learned through trying to help friends and family and former employees navigate the healthcare system. And rather than trying to connect them with doctors I might have known and specialties to get access, they couldn't get access to prices and were blindsided to actually know the price of care before they got care, and blindsided with bills that were confusing, didn't match their experience, and in fact put them in egregious medical debt. Even from being fraudulently billed and overcharged, they had no recourse because they never knew the price to begin with. And so I felt that I would set my biotech and my life science experience aside and actually roll it up into a nonprofit to represent the voice and advocate for the American consumer of healthcare in Washington for policy to deliver real price transparency system-wide. That means wherever we get care, from hospitals and insurance companies alike, that patients will be able to see the prices of care, be in control of their choice to shop for the best quality of care at the lowest possible price. And so it's been quite the journey. And the Trump administration, President Trump, actually invited into the White House the patients that we videoed from across the country that had horrific stories about how they had been blind to prices and overcharged and sent into egregious medical debt. And some even suffered garnished wages and liens on their houses for things they should have never been billed for.
Right.
And so we brought those stories in and those patients into the president and Secretary Azar and Seema Verma and the administration. And we also brought in incredible entrepreneurs, doctors, and surgical centers that left the dark shadows of the opaque hospital system and the insurance world. And they established cash-based, price-transparent medical centers where they direct contract with the patients or the employers and deliver at 1/6 to 1/2 of the price or cost that you would get from an opaque system. Real prices,
Yeah.
the same price for all patients, a fair price, and they are changing the game of healthcare. And so we brought them and also employers that contracted with them to see how this administration and Congress, by just making government mandates for hospitals and insurance companies to give us the free market benefit of competition and a functional marketplace through price transparency. It's been so cool of a journey that the Trump administration actually put rules in place, an executive order.
And those are going into effect now and in the coming year, right?
Yeah, there's by January 1 of
Okay.
2021, hospitals are supposed to post their low cash prices
Right.
and every negotiated rate, as well as insurance companies very soon will be determined to follow suit in the same time frame.
Yeah.
That empowers us to be in charge of our very hard-earned healthcare dollar.
No, that totally
And
makes sense.
this is golden. This will be transformative.
Yeah.
And so we're trying to get it into the phase 4 stimulus, not just in administrative action, but to make it more permanent.
Yeah.
And so that we can expeditiously make sure it goes into effect.
Yeah.
So
Yeah, it's kind of,
that's the mission of patientrightsadvocate.org, is to get everyone in the country to log on to our website, write their senator and congressman. You can click on a button based on your zip code. It'll go right to where your listeners live and they're being a constituent of their congressmen and women, and tell them you want it. You know, let's give the free market a chance, Dan.
totally. Yeah. Yeah. I admire what you're doing. And I haven't been quite as successful as you, but I had a similar life path.
Well, you've been very successful in many different ways, but you're crazy too. You're an entrepreneur.
I'm a little crazy. That's for sure.
We have to be
Talk
crazy,
to anybody.
right? To be an entrepreneur, we have a lot of energy.
Yeah. No, I think entrepreneurs are the solution here. Yeah, I started out wanting to make new medicines, so I worked in drug development. But then, you know, as my life evolved, I realized what you're working on right now is the biggest problem in healthcare right now. We need new medicines, but we need affordable, accessible care more than anything right now. And so it's funny, I was talking to a provider, a really good provider here and well-intentioned, and they were concerned about these coming requirements that they are going to have to be price transparent. So they're going to do it. And they were, you know, talking to patients and customers and getting feedback. And then somebody said something that made me chuckle that was so telling. She said, hey, if we post prices and we're not as inexpensive as other equally good providers, they're not going to come here. And I said, yeah, that's like the free market system.
Exactly. That is the free market system. So hospitals, why don't you sharpen your pencils and sharpen your stethoscopes to compete and the mind share of your docs to provide the best quality of care at the lowest possible price. I mean, that's what businesses do in every other sector of the economy.
And it leads to good and better products and services. So this is kind of economics, and I love talking about economics, but I'm not sure the general public likes talking about economics. You tell stories about people. So talk a little bit about how price transparency impacts patients and the providers, like the physicians and the nurses. How is it good for them? So.
Well, I think that's a really great question. And if we look at the economic side of it, right, Dan, I mean, we wouldn't go to a grocery store and go to buy a gallon of milk and accept paying more than the person in line in front of us, by a factor of maybe 10 times, right? Because we
Right.
had some third party negotiate a terrible price for us, right? Without knowing the price they negotiated until like a month later,
Yeah.
when you find out you paid $500 for that milk that should have cost you $3, right?
Right.
So, I think it's sort of surreal that we accept it in healthcare.
Yeah.
And I think what it has actually been so problematic that people have really been tired of being blindfolded to no prices, then blindsided by these egregious bills that they had no idea would be. And then on top of it, we're expected to pay with a blank check, right?
Yeah.
We give our credit card and we have no idea. We sign that we will be financially responsible for whatever they decide to pick our pocket, right? Whatever they choose to take out of our bank account or on our cards for whatever our insurance doesn't pay.
Without telling us up front what it's going to cost.
Without telling us up front. So I think what we've found, and we've been actually across the country doing market research, and we've been doing surveys, and consistently across the country, we have heard from patients that they don't trust their doctors anymore.
Mhm.
It's very sad, but there is absolutely no trust and accountability because of this financial ruin patients have experienced. And everybody has their own story, right?
Right.
If you don't have your own story, it's either a family member of yours or a friend, or
Yeah.
you're a small entrepreneur business owner and you offer healthcare to your employees and your rates went up 18% last year.
Yeah.
And you already went to a high deductible plan trying to push more costs to your employees to shop. But then how can they shop if they don't know the price? How do they do that? They can't. So I think what it will make, to answer your question specifically, between the doctor and the patient, we believe very firmly from the surveying and the market research, the focus groups, is that it will restore the trust.
Yeah.
And it will get that relationship back to the patient and physician relationship. And even in fact, we have actual empirical evidence of that. And what is that evidence? There's a whole new group of physicians called direct primary care doctors that have been price transparent. And they say, okay, if you're a standard adult over the age of 50, for $70, $75 a month on average, they will post the price, what that fee is. Maybe it's $30 for your children, or maybe some docs actually do the children free of charge if they're under 10 years old.
Yeah.
But they'll basically say, here's your monthly fee, and you can have my text messages. There will be no extra charge for that. They'll do telemedicine, all included in that monthly fee. And your blood tests are generally included in that as well, and many of your other testing. So you know specifically what an x-ray is going to cost, what their tests are going to cost, and what your monthly fee is. And we have seen a mass exodus of people basically getting great primary care with price transparent docs. And that has really returned the trust. And the docs love it.
Yeah.
Because they get to spend a half of an hour in the exam room or more with their patients and actually provide quality care. So
And they're having that relationship with patients that they probably long for and miss, so they can spend time with patients and have that trust. They don't want to be stuck in this big machine that is rewarding them only the more care they provide, the relative value unit. So it's just sort of a bad system. We have a direct primary care system here in Milwaukee, and the physician there charges $100 a month, and you get 24/7 access to him. You can text him anytime.
Mhm.
And he's booked. He can't take any more patients. And he says he loves it so much more than working in sort of the corporate structure, because it's medicine the way he thought medicine was supposed to be practiced. So I think what you're describing is the future. So
absolutely. And those primary care docs give us examples, right? I'm always a storyteller here, but they'll say,
yeah,
one has told me she has 4 generations of a family. And she
Yeah.
said, the grandmother had anxiety. The mother had anxiety, the granddaughter had anxiety, and the great-granddaughter, well, we don't know because she's just a baby, but that doctor treats the entire family. And she said, a little chest tightness in the chest, she's going to first look at anxiety or maybe a little pulled muscle for that family and work them up in her office rather than an emergency room visit that someone might send a 25-year-old person to work them up for a heart attack when the chances are very, very minimal, and they end up going for the ER visits with a $42,000 bill from EKGs and blood tests and everything under the sun run on them, when the primary care dog actually has the history, the family history, and has seen these types of cases go to an emergency room where they really just had a little bit of anxiety and could be treated, well. So, and much more affordably underneath that $100 a month umbrella type of thing.
Yeah. So why did it take us so long? I mean, I was going to ask you what the government should do or shouldn't do to get us here, but I think we sort of touched on that a little bit. But why did it take us so long to get to the point where we're demanding price transparency? Are there barriers? Are there, is it government or providers or insurance that don't want this? What kept us from getting here?
Well, I think one of the first thing was post World War II when Congress enabled the employers and kind of insisted the employers put together an insurance plan to cover healthcare, right? Yeah. And that came out of the employee wages, and that kind of set up this system that is broken with the third party system, right? Mm-hmm. And then we have the power of the lobbyists and the lawyers of the hospital associations and the insurers in government, right, to basically maximize revenues for those hospitals and those insurance companies and in pharmaceutical themselves. So if you look at what I call the healthcare or the medical industrial complex,
yes,
they are the ones that the governors and the legislators, and then in the federal level, that are in the hallways and in the offices, looking out for their own gains. And if you look at 21 states in this country now, hospitals are the largest employers in 21 states. And they are opaque, and they have billions of dollars in endowments, much bigger.
Very beautiful buildings too.
Academic universities even, and big glass atriums, right? But what's happening when a nurse who works there for $14 an hour, it has to work double shift because of a hospital bill that ended up out of network charges, ended her having to get her wages garnished from that very hospital she worked for. And we actually have an example of that from Fredericksburg, Virginia, Mary Washington Hospital. And her bills were taken to court to garnish even more of her wages. So now she's down to $7 an hour, working double shifts, gets dehydrated, and they make her go to their very own emergency room. Mm-hmm. And work her up for a stroke. Now, this is a young woman who was dehydrated and ends up now with $8,000 more in charges and 5 separate court judgments because each bill comes in fragments and each one has a $75 court fee. Yeah. Like, these people are devastated. How do they get out of the hole, right? Nothing's transparent. And she didn't have a choice. And she said, no, don't take me to the emergency room because I just need a water. I just need a rest. And so only with price transparency, and I think patients are fed up. And I think with this pandemic, actually, Dan, people know they're being gamed. The American public is not ignorant. Yeah. They know their pockets are being picked, and yet they're scared to go to hospitals. In fact, we surveyed them, and half of them in this pandemic, we just got out of the polling last week, and we saw that half of the people are fearful to go back for ordinary care because of the possibility of getting COVID.
Yeah.
And the other half are fearful of financial ruin because they don't know what it's going to cost them.
Those are the two things. And we've all been hit with that. I mean, with the high deductible plans, all of us have been hit with these big $500,000 bills, or we know somebody. And for a lot of people, that's devastating. That pushes them under, maybe to bankruptcy. But then, the COVID is making us more aware of infectious disease. But, the most likely place to get infected with something is a hospital. So you're right. COVID is forcing both of these things.
Yeah, we just have one school teacher, Carberry, who her video is going to be on our website very soon. And she went for a COVID test thinking it was free from the government, went into a tent in the parking lot outside of an emergency room, got tested, but then they said, oh, you need an EKG. Oh, we're going to give you a pregnancy test. We're going to give you a chest x-ray. By the time she left, she got her test.
Yeah.
She came out positive for COVID, went home just to quarantine, nothing to do. And, you know, she ended up with a $6,500 bill. Okay. A $6,500 bill, which she thought was going to be a free test because they upcharged her on everything else.
Yeah.
And yet yesterday I talked to a dental hygienist who went to a parking lot tent, and her town had set up free testing, and she got her test for free. How does anybody know? Right?
Yes.
How does any know what tent to go into? Right? Yeah. How do I know if that tent's a free tent or I'm going to get whammed with $6,500 worth of tests and things that I never needed to begin with? And only through transparency. So I think this COVID-19 virus pandemic has actually shined the light on the brokenness of our healthcare system. And as we sit at home and we use our computers to communicate like you and I are doing now on your podcast, buy things on retail, even our groceries, and anything of our supplies from things like Amazon, or get our groceries online. The major thing that we need in healthcare is to be able to do the same. And I think there's a silver lining in the COVID-19 pandemic, and that is that we have this Trump administration rules, Dan, for hospitals to have to show their prices and insurance companies as well.
Yeah.
But you know what happens when the administration issues rules? What do you think happened? The hospitals sued.
Yes.
They sued. They want to delay the game and they want to sue.
Yeah.
And even if they don't have a leg to stand on, they're going to try to delay through the courts, right? And they think they have the right to keep gag orders and keep their prices hidden.
Yeah.
But we actually know the prices. We just don't find out till after the fact. So they are in the public. It's just after the fact. We just want them to give it to us before we get care and give us choice. But they want to keep it hidden. So the only way we can actually expedite these rules to actually go into effect next January is to get it put into law. And right now we have phase 4 stimulus. And so I think the silver lining in COVID-19 is in this phase 4 stimulus at no cost to the taxpayer. Absolutely no cost. The Congressional Budget Office scored it.
Just
but
to require
a tremendous benefit. All congressmen and women could sign in these rules to be codified by law.
And that should be bipartisan. And I think both parties see that consumers want to know what prices are because they know their constituents have been hit with these big bills. The kind of thing that intrigues me is, you know, you talk about COVID because we're all sort of doing telemedicine now because we have to, but we're learning that it kind of works. And, you know, you can have a visit for, you know, $20, $50, $100. Now I've heard of this concept that I just learned a month ago, price parity, which is the hospitals want the charges for telemedicine to be the same as their excessive charges. Of course they do. That's anti-competitive.
Of course they do. And they were authorized to have that during this emergency time. And guess what happened? Guess what happened? I can tell you what happened.
Tell me,
We've seen these big opaque hospital systems actually defraud the government and defraud patients by doing outbound calls to their patients, checking up on them. And for a 5-minute phone call or video, they get paid the same. So we're seeing in Boston, Brigham and Women's Hospital charged a patient 3 times, $290, because that patient just called in and said, hey, where can I get a COVID test?
Yeah.
And they said, oh, you're young, you don't need one, stay home, quarantine, and you'll be fine. And in the meantime, the hospital realized, oh, wait a minute, we had a caller on our line. And they called outbound and charged nearly $1,000 with 3 separate calls to this young woman, racking up fees. And the woman wasn't even sick. She never initiated to do anything other than a curiosity of a COVID test. So, you know, unless we have transparency, you know, we can't get at that. And why should they be paid that when the very company, the employer of that young woman, had a telehealth plan with a company called Well Connect, which was $60. The company paid $50 of that. And she would have otherwise just had a $10 copay.
Right.
For 24/7 access to telemedicine. So had she known that that physician she called at the major hospital system was going to charge her $290 and several times just checking up on her, she would have never reached out to that doctor.
Yeah.
So these are things where people don't know. And unfortunately, we have a healthcare system that is a for-profit system. Even nonprofits are making beaucoup dollars, and they find other ways like developing new buildings and buying more real estate and not paying taxes on that real estate.
Yes.
And to use it as expenses, right, against their revenue stream. So I think the thing that will be most transformative, and like you said earlier, this is a bipartisan issue, is price transparency. We saw in the Harvard-Harris poll last May, 90% of all Americans support government mandates for insurers and hospitals to show prices.
Yeah.
And that was just reiterated again by a group of urologist society, and they came out of the field with 91% support.
So that is, I think, going to fix the problem as long as there's no barriers to competition. So if I want to use my $50 telemedicine and not my provider's $200, I should be able to.
Absolutely. And you should be able to have recourse too.
Yeah.
If you think, in a restaurant, right? If we got a steak when we ordered the salmon,
Yeah.
the chef and the waitress take back, or the waiter take back the steak, right? And they don't charge you for it. It was their mistake. You ordered the salmon. But in a hospital, even if they operate on the wrong knee, and they got to operate on the other one after operating on the wrong knee, they charge you twice. They charge you for both knees. And they'll say, oh, don't worry, your insurance will cover it. And we've got a third party, you're covered. Oh, maybe that knee needed to be done after all. But, we wouldn't accept that in any other facet.
No, not at all. And that kind of gets to one of my last questions, because a lot of people will say, well, we've always had sort of private delivery and competition and markets in healthcare. Why should we do that? It didn't work. And that's why we want Medicare for all. Would you say that, have we ever had competition in healthcare? Or
We've never given the free market a chance, a functional free market. And to your point, one where there aren't barriers that prevent competition. So I think the beauty is that we do have bold innovators like Dr. Keith Smith, who started the Free Market Medical Association, and he's in Oklahoma.
Right.
And he started Oklahoma Surgical Center 12 years ago, co-founded it, and with his partners for over 12 years now, they have provided price transparent, full-scale surgeries. And whether you're a diabetic with a complicated health record, or you're a healthy young person, you're going to be charged the same price for that hernia repair, even though the risk may be higher and it may require more intervention. And so same price, all patients. And then on top of it, they stand behind their prices. There's not going to be any surprises. So you pay, and you know what you're going to pay up front. They're about 1/6 to 1/5 the cost of the opaque hospital systems. And now over these 12 years, they've actually changed their prices 4 times. Right. And Keith tells us that he's only lowered the prices. He only lowered the prices. And he said, we get patients, and he goes, we are busier than ever. I just talked to him yesterday. We are busier than ever since COVID, with people flying from all over the country in states that are shut down to come get their surgeries done with us. And he said, and moreover, Cynthia, we see people are calling us up, like a woman in Georgia who could get her surgery there for $3,600. And she was quoted $40,000 as an estimate from her insurer. $40,000, where she had a copay, co-insurance, and a high deductible. So she said she used their prices online, and a couple of other surgical centers like them, like Texas Free Market and York OSS Surgical in York, Pennsylvania. She used those online prices and went and negotiated and got the $3,600 price in Georgia.
Yeah.
And one more thing about Georgia.
Okay.
In 21 other states in the country, Walmart is the biggest employer.
Okay.
People know how to shop at Walmart, right?
Oh, yeah.
And we can count on Walmart for giving us quality products at low prices we can afford, right? And rural people have access because Walmart's in many different states and rural centers as well as urban.
Yeah.
And in Georgia, they piloted price transparent medical clinics affiliated with their stores.
Right.
And they've posted their prices online. Any of your listeners can go. And I love it. I actually thanked Rob Walton, and chairman of Walmart. And I said, please go as fast as you can in every Walmart throughout our country to provide your medical clinics. $40 for a doctor's visit, $10 for an x-ray, $25 for a dental cleaning.
Yeah.
And eye exam, $45, and mental health, $1 a minute.
And they're everywhere, rural America, where it's not easy to get access to healthcare. So.
That's right. And so when hospitals have to compete with quality care integrated and at those low prices, that's game changing. That will revolutionize. And, you know, then we can look like Steve Forbes, economist Steve Forbes and Larry Van Horn, Art Laffer have all said, look at Singapore. Singapore's percentage of GDP economically is, you know, I think it's 5% of their GDP is spent on healthcare.
Yeah.
We're at 18%.
Right.
So when we change this and get those Walmart prices and competition, think of all the silver lining of COVID-19, getting this permanent into the stimulus. And I call it, you know, the silver lining ends up putting silver dollars back into the pockets of patients.
Yeah.
And I'm looking forward to the reality of that.
Yeah. No, it's going to be much better. So, so I guess my last question for you then is, we have an election coming up. What would you want the politicians to know and be thinking about, and the voters? So what would you tell Donald or Joe if you had like a minute or two with them? What should they be thinking about?
Healthcare is the #1 issue in our country.
Mm-hmm.
And it's time to give free market medicine and healthcare a chance, and a functional free market. That means we got to allow for broad scale competition. And the only way that we can compare prices and quality like we do in every other facet of our life is to know prices before we get care.
Yeah.
When the American consumer, who is the patient, the worker, the employer, and the taxpayer, when we, the American consumers, can see prices, then we can shop for the best quality at the lowest price and purchase healthcare we can afford.
Right.
And that will greatly reduce both the cost of healthcare and health coverage, and allow innovative entrepreneurs to disrupt and reform healthcare and give the free market a chance. And I think that we're at this moment in time where no matter where we go forward, price transparency will benefit all Americans and be a stimulus to bring both the individual, families, communities, and our country back to economic prosperity.
Yeah, I couldn't agree more. And I think, I hope that they can both see that price transparency is important and necessary, but also that you should be able to act on that. You should be able to go where you want to go based on price. That's the other element to all of this too. So.
Yes, absolutely. And won't that be fun? I mean, we will change the game. And so I would just encourage also that it's critical that we get this in the phase 4 stimulus, which is expected to happen by the end of July, beginning of August.
Oh, I will keep my fingers crossed.
So keep your fingers crossed. It costs the taxpayers nothing. And we know it will be a tremendous benefit to all of us. So I would just encourage anyone who listens to your show and any of us know to write into their congressman. And we made it really easy by putting a link on our website. So if they go to patientrightsadvocate.org, they can simply write in and ask their congressman to please put healthcare price transparency in the phase 4 stimulus.
That sounds great. Well, and then maybe when you come speak on July 31st, we'll have an answer to how that went. We can talk about it then too. So
I would love to have that happen. And so, God willing, we'll all be that fortunate to see prices before we get care and be in control of our very precious hard-earned dollars.
Absolutely. Well, thanks, Cynthia, for speaking with me today and on July 31st as well.
All right. Thanks, Dan.
Sure.